this is Dr. Matt Viscito at Unity Medical Center here in Grafton. Just wanted to reach out to our community and talk a little bit about the ongoing coronavirus COVID-19 situation that we're all dealing with. I'm sure that everyone is sick and tired of hearing about it and having to deal with it, but we just want to let you know that here at Unity Medical Center, we are doing our best to make sure that we are ensuring the safety of our patients and our community and our employees. We continue to monitor and follow the CDC guidelines as well as directives from the North Dakota Department of Health. We know that some people may be frustrated with the ability or speed at which patients can get tested for COVID. Unfortunately, there is limited testing ability still, and we do have to follow those guidelines that are set forth by the CDC and the Department of Health as to who and when we can test. We very, very much appreciate the community's overwhelming response. We've had so many people offer and bring in masks that they've been making to help protect staff and patients and family members, and we greatly appreciate all those that have reached out and done so. We've also received many offers of N95 masks that people had in storage, and we greatly appreciate that as well. Please do rest assured that at this point we have plenty of personal protective equipment on hand. We continue to take stock, and we've ordered some from the state cache that the Department of Health has available, and we do have plenty on hand at this point to be able to take care of any patients that come in the event that they either possibly have COVID or do eventually get diagnosed with it. As far as our clinic visits go, as some of you are probably aware, we have limited our clinic visits as much as possible to those that are absolutely necessary in an effort to keep everyone as safe as possible. Of course, we do want to continue to take care of people, and therefore we're expanding our telehealth availability. There are a couple of different platforms for which we can do that. So if you are interested in seeing your doctor or provider here in the clinic by telehealth at home, please do reach out to our clinic. Either the front desk or your particular provider's nurse can help you figure out how we can get that done for you. Obviously, lab testing and that sort of thing would have to be done on site, but we could figure out the most safe and easy way for that to get done. But like I said, please do reach out to the clinic if that's something that you're interested in pursuing. As far as keeping everyone as safe as possible, I very much appreciate the fact that most people do seem to be following social distancing guidelines and avoiding unnecessary travel. Continue to wash your hands, continue to avoid touching your face. The CDC has issued a recommendation that everyone going out in public wear a mask. For that purpose, homemade masks are felt to be adequate to decrease risk. You are unlikely to catch COVID simply by walking by someone else. It is a significant amount of contact that is necessary, but we do worry about contact with surfaces on which the virus could have been deposited. So if you are wearing a mask, you are much less likely to spread it if you have it, but do be sure that you are washing your hands, because if you touch a surface where that virus has been deposited and then touch your face later, you could potentially be infected that way. Moving forward, we're doing our best as a community and as a society to keep cases as low as possible while continuing social distancing. It's of course not clear what unraveling all this is going to look like, and we're of course concerned that once travel and businesses start opening up again, there will be an increase in cases, but the hope is that as it happens on a gradual basis, we're not going to see a huge spike, and therefore we'll be able to handle that demand. If you do have any questions or concerns, please do reach out to us. We do have COVID screening available through the clinic during daytime hours, and we do continue to ask that if you have symptoms or have concerns that you call before you come. Our number is 701-352-2000, and someone at the clinic will be more than happy to help sort out what the best way to get your care performed would be. Additionally, if you are acutely ill and do need the emergency department, it of course is open 24 hours a day, 7 days a week. But if you are having respiratory symptoms or otherwise feel that you may have been exposed to COVID or may have it, calling ahead would again be beneficial to help us sort that out. Of course, if you have an emergency, you can always call 911. In closing, I just want to say thank you for your time. Thank you again for all you're doing to help limit the spread and keep everyone safe in our community by social distancing and avoiding unnecessary travel. I also want to reassure you that we are doing our best to keep our staff safe, and do want to also thank you for trusting us with your health. Our community, our patients, and our staff safety, again, is our top priority. Please, by all means, reach out to us if you have any questions or have any other needs. We here at Unity Medical Center, Grafton Family Clinic, and Park River Clinic are here to help.